Hi, Dr. Reynolds, and you were talking to us about the polio epidemic back in the 50s.
Yes, I was a resident here at old James Walker Hospital. I had 1 year in between, and I took it as a resident at old New Hanover Hospital. And that was a year that the polio epidemic, and the one thing that I remembered was that a lot of children had a low-grade fever and a headache. And the pediatricians were so busy that all of them would need a spinal tap. And all of them would say, well, go ahead to James Walker and Frank will do a spinal tap on him.
How many spinal taps do you think you do a week?
I was doing 7 or 8 a day. Majority of them were non-paralytic. In other words, they had maybe 80 to 100 cells, but they didn't have any symptoms, and so they sent them home and put them to bed and on the aspirin and a Tylenol, and they were fine, and they never developed any paralysis. A certain number had certain paralysis of certain muscles. I was at Children's Hospital in Philadelphia for 2 years also.
And how many beds were at the Red Cross Hospital?
I mean, beds at which hospital?
At James Walker, the old James Walker.
Oh, it was a little over 100 beds.
Mm-hmm. That's a big hospital.
It moved from James Walker, moved to the present New Hanover Hospital.
And how often were you on call during that time?
A long time. I came back here for 50 years, 1950, and I didn't close till 2000. That was 50 years.
And back in 1950, how many times a week were you on call?
Well, when I was practicing, I was on call all 24. There were enough pediatricians around, that I had my own patients. If they called me, I treated them.
And did you go to their house? Did you go to their house? Did you make house calls?
Yes, made a lot of them.
And how did patients pay you for your visits? Was it always with money, or did they pay you?
No, different ways, I guess. A lot of them had insurance, and I'd fill in whatever form they had, and so I didn't worry about the money part.
And you practiced for how long?
60 years.
Well, thanks for visiting with us.